Good evening. I'm Dr. Mansi from Homeopathy 360 and I will be the host of this webinar. First of all, I would like to thank Dr. Supritha for being the speaker of this webinar, which is on topic acid group in homeopathy. I would like to share a short biography of Madam Dr. Supritha. He is currently working as an assistant professor in Department of Homeopathic Materia Medica at Guru Nanak Homeopathic Medical College, which is at Ibrahim Patna. And she is currently running a clinic at Saidabad and treating various cases like infertility, psoriasis, eczema, osteoarthritis, and what not disease. And also, she has treated many other systemic disease and psychological disorders successfully. And dear audience, I would like to share that she has achieved various good ranks in her career of BHMS. I mean, she has a very good record of her academic results. Either it is physiology, homeopathic pharmacy, organon, repertory, or PSM. I mean, she has achieved at various ranks like 8th, 7th, 9th, and whatnot. So, ma'am, I think you are a book form in your BHMS career. So now I would like to hand over the mic to Dr. Supritha, madam. Please, ma'am.
Yeah. Thank you, Dr. Mansi.
You're welcome, ma'am.
Yeah. Can I start my session?
Yes, sure. Please.
Is it visible, Dr. Mansi?
Yes, ma'am, your PPT is visible. Please continue.
A very good evening to one and all. So let us start with the acid group today. So first of all, let us know the definition of acid. So acid can be defined as a substance that can provide H plus ion, that is a proton donor, or any substance that liberates hydrogen ion in a solution is a hydrogen ion donor. So where did the name come from? So it is coming from Latin and acius, that means sour. Coming to the origin, acids are derived from the mineral kingdom and vegetable kingdom. So what are the physical and chemical properties of the acids? It's a brief introduction. Most of the acids are colorless or light colored. So they are mixable with water. Some acids are odorless and some are having their own peculiar odor. Acids evaporates when heated. All the acids are corrosive in nature. All acids are sour to taste. Acids combine very easily with other elements to form compounds. So now coming to the classification of acids. There are two types of acids, organic acids, which are also called as weak acids, which have slow and progressive, and these produce deep pathology. Inorganic acids, strong acids, or mineral acids, these the action is rapid, acute, produce deep pathology. So whatever the acid is, the pathology is very deep. Coming to the important remedies in homeopathy, whether it be inorganic acids or organic acids. So first we'll list out the inorganic acids. That is muriatic acid, hydrocyanic acid, nitric acid, sulfuric acid, boric acid, butyric acid, chromic acid, phosphoric acid. Coming to the organic acids, so benzoic acid. What are organic acids? Anybody can answer? What is the difference between inorganic and organic acids? Well, organic acids contain carbon as their compound. So benzoic acid, acetic acid, carbolic acid, picric acid, lactic acid, oxalic, formic, citric, salicylic, succinic, sulfonic, tartaric acids. So all these remedies are used in our homeopathy, right? So now what are the acids that are derived from mineral kingdom? So these are the mineral acids. Fluoric acid is from the distillation of fluorospar calcium fluoride. Muriatic acid is obtained from halogens. Nitric acid is a combination of nitrogen and oxygen. Sulfuric acid, hydrogen, sulfur, and oxygen. Phosphoric acid, hydrogen, phosphorus, and oxygen. So coming to the acids that are derived from the vegetable kingdoms that are also called as organic acids. The acetic acid, the principal ingredient is vinegar. Benzoic acid, it is obtained by sublimation of gum resin. Coming to the butyric acid, it is obtained from butter. Citric acid is found in oranges and lemons. So many plants contain hydrocyanic acid or prussic acid. Next is lactic acid. So the source is sour milk. Malic acid, source is apples, pears, and raspberries. Then sorrel grass, oxalic acid, which is having sour leaves. So this oxalic acid is responsible for giving their acidity. This acid is also present in rhubarb. Salicylic acid. This is found in spirea blossoms and gaultheria. So coming to the ailments of the acid group. Here, ailments from surgical shock, grief, loss of sleep, mortification. There are other ailments we'll discuss here. I want to compare ailments from grief. We can also compare with any other remedies. Yes, please. Dr. Mansi, is the mic open to all?
Yes, ma'am. I guess the mic is open to all.
Yeah.
And it's a very good question.
Thank you,
That
Dr. Mansi. Anybody can answer. So can we compare grief remedies?
I'd like to give a hint to all of us that we can compare grief ailments with the remedies which we called women's remedy. We have various remedies in homeopathic materia medica, which we call them. These remedies are women's remedy, right, Dr. Supritha?
Yeah, exactly.
Yes.
Fine. So grief we can compare with ignatia, acute grief. Then long-standing grief is natramure. So coming to the
Yes.
yes,
Yes, ma'am.
yes. So loss of sleep, mortification. What is mortification is the self-pride is hurt. So then ailments from debauchery. Debauchery is indulging in various drug activities, alcoholism, and sexuals. Then injury we can compare with remedies like arnica, ruta, bellis. Coming to the other ailments, bad effects of bites and stings. Here we can compare with the animal remedy, that is Apis mellifica. Another ailment is loss of vital fluids. Loss of vital fluids, we can compare the remedies like China. So ailments after anesthesia, abuse of narcotics, occupational hazards, physical and mental exertion, infections, bacterial and viral. Coming to the constitution, I think from the pictures you can identify the constitution. The person is thin, weak, broken down constitution, fair, hair loss is there and baldness will be present, pale, anemic debility, prostration with stooped shoulders and premature old look. So this is very characteristic of this acid group. So another remedy which has stooped shoulders. The person will be walking with stooped shoulders. Can anybody answer? Person walks with stooped shoulders, shoulders bending forward.
So many people answering sulfur.
Okay. But it is
Okay.
phosphorus.
Yes, it is phosphorus.
Phosphorus. So
If
phosphorus
we
person walks, the person is also lean and thin, and then
and
person walks with
tall, and they
stooped
are also
shoulders.
tall. Phosphorus
Tall.
is also tall with stoop shoulders.
Yeah. Coming to the thermal relationship.
Mhm.
All the acids are chilly except fluoric acid and picric acid. So picric acid and fluoric acid are hot remedies. They are aggravated by heat. Diathesis is hemorrhagic diathesis. Miasm, all the miasms are present. Predominantly it is syphilitic miasm. Inorganic acids are predominantly syphilitic. Organic acids, mainly they are psychotic and tubercular. Coming to the sphere of action of these acids. So inorganic acids, skin and mucous membrane is their main action. Blood and blood vessels. So these are the main spheres where inorganic acids act. Coming to the organic acids, action is upon the muscles and tendons, the connective tissues, endocrine organs, soft tissues, sexual organs. Coming to the pathophysiological action, they decrease the acid secretions in the body and increase the alkaline secretions of the body. So, for example, when you consume citric acid, the acid secretion in the stomach is reduced, but the saliva secretion is increased. So, saliva is alkaline, right? So, this is the pathophysiological action. So, it also has irritant cathartic action. There are bleeding cracks, fissures, and fistula. Is burning is there, patient with severe pain due to ulceration and painless conditions such as gangrene. Fever of all the types. So, toxemia, septicemia, ulceration, and malignancy. Allergic hypovolemic shock. So, it is also the action, pathophysiological action is anemia, leukemia, hemolytic jaundice, and metabolic acidosis. So, if you see the doctrine of signature, these acids produce irritability of the fibers together with weakness and prostration. So, the same way, nature of the people is also same. Those belonging to the acid group. Coming to the characteristic mental symptoms, as I have already told, irritability, prostration, and weakness is the main characteristic symptom of the acid remedies. Exhaustion is prominent. Always they feel tired. Always there a feeling of tiredness is there. They want to sleep. They are drowsy. Also, there is irritability and aggression. Hurriedness is there. They work in hurry. Whatever they do, all the things they do in hurry. They are perfectionists. They are termed to do their each and every work very perfectly. Can you name other perfectionists? Any other remedies? Sorry?
Arsenicum album.
Arsenicum album, right. What about hurriedness? Can you compare any other remedies? Hurriedness? Okay. Irritability and aggression? So, irritability and aggression we can compare with. One of the remedy is Nux vomica. Hurriedness also we can think of argentums. So, these people are extroverts. Unification is seen. Perceiving power is decreased. As I already mentioned, they are always tired, drowsy, and then also they are, on the other hand, they are anxious and excited. They are weary of life. They are covered. Covered is we can compare with covered remedy. Can compare with lycopodium. Loquacious, we can compare with snake group. That is ophidia. Aversion to company. They always wants to be alone. Indolence is preferred. Obstinate, egoistic, fastidious. They are malicious, jealous, and suspicious. This can compared with ophidia group. There is weak memory and confusion. Always confusion is present. Whether to do this or that, or whether to choose this or that. So the disorientation is present. Then they are always restless. They cannot be in one place. Indolent. Indifference is present. Apathy. So indifference. Also other remedies are main remedy. Women's remedy. What are the other remedies for indifference?
Yeah.
Sepia. Right. So apathy is seen. Violence. Restlessness. What are the trios of restlessness? Anybody?
Sir, Rastox Aconite.
Right. Arsenicum album, Rustox, and Aconite. So nymphomania is present, disorientation, industrious. So restlessness as a in arsenicum album, what is the type of restlessness? It is both mental and physical. Whereas in Rustox, it is physical restlessness. In Aconite, it is mental restlessness. Coming to the characteristic physical symptoms. So there is weakness and debility, always inclination to lie down. Mineral acids, they produce irritability of fiber with weakness and prostration. Vegetable acids produce weakness without irritability. So vegetable acids are nothing but organic acids. So they have corrosive action. Hemorrhages which are profusely bleeding and bright red in color. Bright red hemorrhages are seen in one of the remedy is nitric acid. Phosphorus is also bright red. Dyspepsia, and there is aversion to food, inclination to eat too much, and then there is dyspepsia, and later on they will have the irritations and aversion to food. Diabetes, ulcerations, pseudomembranes, offensiveness. All the discharges are offensive. It is also having rheumatism. It is indicated. The acid remedies are indicated for rheumatism. Already we have seen organic acids. The action is upon the muscles and tendons. Pseudomembranes. So what are the other remedies which we can indicate for pseudomembranes? Pseudomembranes? Yes. Mercury group. So mercury group also pseudomembranes. The action is upon the pseudomembranes. That is diphtheria. There is suddenness of any sudden onset or suddenness of any complaints, then the loss of vital fluids, debility at the mental and physical level. Discharges are watery, acrid, sour, stained with blood, excoriating, and offensive. They are very much oversensitive. There is deficiencies. So if you see the skin complaints, there is sepsis, loss of hair, brittle nails. So this can be more seen in inorganic acids rather than organic acids. So if you see the tongue is thin, burning, cracked, ulcerated, blackish or brownish coated tongue. So the taste which comes is sour and putrid. So the acids are sour and putrid taste is there. So there you can compare with the doctrine of signature. So if you can see this tongue, deep centrally cracked tongue, so nitric acid is the indicated remedy. Cracked fissured tongue, that is chloric acid. So coming to the clinicals, it is these remedies are indicated for spasms, epilepsy,
Excuse
typhoid
me,
fever.
ma'am.
Yes.
I would, as we are talking about tongue, I would like to interrupt here.
Yeah.
A very good question comes up in my mind.
Okay.
Can we have the answer for the mapped tongue?
Yeah, sure. Anybody from the audience?
It is a very characteristic symptom,
Yes.
and in various MCQs, it is being asked that which remedy is indicated for mapped tongue. Can anybody answer? Yes, someone has just answered. It is natrum mule.
Right.
Okay,
Yes.
please continue.
Okay. So clinicals. So these remedies can be indicated in spasms, epilepsy, typhoid fever, catarrh, ulcers, aphtha, hemorrhages, diphtheria, hemorrhoids, anxiety disorders, cerebral accidents, all types of inflammations, pneumonia, shock, myocardial infarction, urinary retention, gout, rheumatism, rheumatic heart, bone disorders, varices, sexual disorders, neurasthenia, spinal cord degeneration, writer's palsy. So, what are the other remedies for writer's palsy? Any other remedies? Ruta is one of the remedy where the ulnar nerve is affected. Okay, right. So if you see the desires and aversions of the acids, desires, alcohol, acidic food, citrus fruits, canned and indigestible foods like chalk, pencil, mud, paint, egg, meat, etc. So the other indigestible, so this is called as pica. What are the other remedies?
Alumina,
Alumina. Yes.
calcarea carb,
Calcarea carb, silicia, right? Yes.
yes,
Okay. What is a remedy where there is hereditary alcoholism? A remedy which can be indicated in cases of hereditary alcoholism. If we can see in boric, it is mentioned. Hereditary alcoholism. Anyone?
cyprium,
Yes, syphilinum. So syphilinum is a remedy which is given in hereditary alcoholism. I'm sorry. What is another medicine which we give in tincture form for alcoholism?
sulfuric acid,
Okay. Tincture form. Another.
Fluoric acid.
Yes, sulfuric acid is right. So another remedy, it is a rare remedy, that is quercus. Quercus. Okay, that can be given in tincture form. Fine. So aversions of acids: heavy food, pulses, sweets, oily and fatty food, cheese, icy cold things, and ice creams. Coming to the general modalities: aggravation in the night, exertion, cold food, cold drinks, loss of vital fluids, loss of sleep, mental tension, anxiety, worry, grief, and touch. So all these are the aggravating factors present in the acid remedies. So amelioration by rest, heat, short sleep, eating after eating, and discharges like profuse urination. So what are the remedies aggravated in fasting? When somebody fasts, people are irritable or they get headaches, they get anger. What are the remedies we can indicate apart from these? So Ophidia group, where there is aggravation from fasting. Amelioration, discharges like profuse urination. So remedy where headache gets ameliorated by profuse urination. What is the remedy?
Calcium.
calcinium,
Gelsemium, right? Okay. Um, we'll come to the remedy relationship. So it is similar to halogens, Ophidia group, and ammonium group. So in many places we were comparing maliciousness, suspiciousness, jealousy, then aggravation from fasting. All these symptoms are we can compare with the Ophidia group. Okay. Ammonium group is chilly again. Coming to the individual remedies like acetic acid. So acetic acid adapted to pale, lean persons with lax, flabby muscles, face pale and waxy. So there is great prostration after injuries, also compared with sulfuric acid. So after surgical shock and after anesthetics. Thirst is very prominent in acetic acid. Okay. Thirst, there is intense burning, insatiable, even for large quantities in dropsy, diabetes, and chronic diarrhea. But whereas in fever, there is no thirst. What about epis? Epis? Epis also, there is thirstlessness all over. Okay. What are the trios of thirstlessness?
Pulse.
Yes, trios. One is pulsatilla. What are the other two remedies? Apis, gels,
Apis.
and yes,
Apis.
Apis mellifica, gelsemium, and pulsatilla. These are the trios of thirstlessness. So, inhalation of vapor of cedar vinegar has been successfully used in the croup and malignant diphtheria. Acetic acid the person that cannot lie on the back. He cannot sleep while lying on the back. So he another remedy sleeps better on back is arsenic. Sensation of sinking in the abdomen causing dyspnea. Rest better lying on the belly. So that is ammonium carb. Any other remedies? Lying on abdomen.
Olocin.
Sorry,
Olocin.
Holosynth. Any other remedies? Okay, we'll discuss about this. Hectic fever, skin dry and hot, red spot on the left cheek, and drenching night sweats. So the spots on cheeks. Any other remedies can you compare?
Chamomilla.
Yeah, chamomilla, red hot cheeks. One cheek is hot, other is cold. Coming to benzoic acid. So benzoic acid is an organic acid. Here you can see the formula. Carbon is present. Carbon, hydrogen, oxygen. Okay, these are the components of benzoic acid. So if you see, this is an organic acid. This is indicated for gouty, rheumatic diathesis. Okay, so gout aggravated at night, especially in the night, there is aggravation of the pain. Okay, pain in the big toe, especially the big metatarsal joint. So urine is very much offensive, highly urinous odor, and it is darkish brown in color. Diarrhea of children, white, very offensive, exhausting liquid stools running right through the diaper. If you see in the children, the stools are very, very liquidy and they are very much offensive. Okay. Coming to the fluoric acid. Fluoric acid complains of old age or of premature old age in syphilitic mercurial dyscrasia, and young people look old. So there is caries and necrosis, especially of the long bones, because these are very much syphilitic. So there is caries and necrosis. So abuse of mercury. If you compare the ulcers we can compare with many other remedies like nitric acid, Merxol, and all. So in fluoric acid, the ulcers presentation is like red edges and vesicles, decubitus ulcers, copious discharge, aggravation from warmth, amelioration from cold, violent pains like streaks of lightning, confined to a small spotty or small spots or in or silicia. So pain in spots. Pain in spots. What are the other remedies? Yes,
Bye.
Calibite, right. Another acid. Pain in spots.
Oxalic acid.
Oxalic acid, right. So pain in spots, we can distinguish between oxalic acid, chloric acid, and calibic. So they at a particular point, the patient will point out and show. Okay. Then coming to the muriatic acid. So muriatic acid, mainly it is indicated hemorrhoids, where it is the hemorrhoids are swollen, blue, sensitive, and painful to touch. They appear suddenly in children, too sore to bear the least touch. Aggravation from least touch, and even the bed sheet or plain cloth is cannot be bearable by the child. So there is prolapse while urinating. So if you see the stool diarrhea, it is involuntary while urinating and on passing wind. So you can compare with allosocotina. They cannot urinate without having the bowels at the same time. So they have to urinate, means they are simultaneously passing stools. There is great debility here, and it is also indicated for typhoid fever. There is deep stupid sleep is present. So what are the other remedies for typhoid fever?
Baptism.
Yeah, mainly indicated is baptisia. Even arsenicum album can be indicated. Okay. Then unconscious while awake, loud moaning or muttering, tongue coated at the edges, shrunken, dry, leather-like, paralyzed, involuntary fetid stools while passing urine, sliding down in the bed. So, muttering, delirium. Delirium, can you compare other remedies, please?
Belladonna.
Yes, belladonna. Any other remedies? So in Solanaceae family itself, there is a lot of delirium. What are the other remedies belonging to Solanaceae, please?
Stramonium.
Stramonium, right? Stramonium, hyoscyamus. Okay.
Yes.
Yes. So coming to the nitric acid. So nitric acid especially suited to thin persons of rigid fiber, dark complexions, black hair, and eyes. Excessive physical irritability. All the pains in the nitric acid are sticking, pricking as from splinters. So it is also indicated for fissures where there is sharp and pricking kind of pain in the rectum. Okay. And there is active bleeding. That is, bleeding is bright red in color. It passes frankly. Frank passing blood is there, seen in nitric acid. Okay. Then it is also indicated for ulcers where slightest touch bleeds. Okay. Or in the mouth. Okay. When there are aphthous ulcers, slightest touch, there is bleeding. Coming to the urine, horse like smell, horse urine smell. Strong smell is present in nitric acid. Then it is cold when it is passed. Urine is cold when it is passed. Then turbid looks like remains of a cedar barrel. So this is about the nitric acid. Coming to the phosphoric acid or acid phos. Here it is mainly indicated for people or individuals who are debilitated by loss of vital fluids. So loss of vital fluids may be blood, menstrual blood, or semen. Okay. Uh, the person is listless, apathetic, indifferent to the affairs of life. They are prostrated and stupefied with grief. Diarrhea is painless. So this is the most characteristic symptom of phosphoric acid, where painless diarrhea is present. Not debilitating, and they are not prostrated, that there is no weakness. Even after passing so much stools, there is no weakness. And the diarrhea is white or yellowish, watery from acids, involuntary with the flatus. Profuse urination at night of clear, watery urine, which forms a white cloud at once. So urine is whitish cloud in nature, right? Cerebral typhoid or typhus, and there is apathy and stupor. Coming to the picric acid. Picric acid, there is brain fag of literary or business people. Slightest excitement or mental exertion or overwork brings upon headache and causes burning along the spine. So this is the most characteristic symptom of the picric acid. There is great weakness of the spine and back, softening of the cord. So also compared with phosphorus and zinc metallica. Weariness progressing from a slight feeling of fatigue on motion to complete paralysis. So there is always tired feeling all over the body, they, especially in the limbs, the hands and the legs. And they are aggravated on exertion. So amelioration from cold air, cold water. Aggravation is seen from least mental exertion, motion, study, and wet weather. So headaches after uh, headaches in school going children. Can you compare any remedy? Can you headache in school going children?
Natromure.
Natriumur, right? So next acid is sulfuric acid. Sulfuric acid adapted to light color, light haired old people, especially women. Child has a sour odor despite careful washing. So other remedies, sour odor, we are comparing with heparsulf, magnesium carb, rheum. Okay, there is sour irritations and sets teeth on the edge. So if you see the tongue, there is teeth are imprinted on the edges. So what are the other remedies? Teeth imprinted on the tongue. Syphilitic remedies. What are the other remedies? So mercury group. So bibliography, I have taken the text from J.D. Patil, Group Study in Homeopathic Materia Medica, Allen's Keynotes, William Bory. So thank you. Thank you one and all. I thank Homeopathy 360. I thank Dr. Mansi for hosting this. Any questions are welcome.
Thank you so much, ma'am. And to all of you, if you have any questions regarding this webinar, you can ask. Please share your questions. Anybody? Do we have any questions? Ma'am, your screen, I think it is stopped.
Should I stop?
Yes, now it is visible.
Yeah.
Okay, ma'am, from my side, I have a question from this webinar.
Yeah.
You have mentioned the term fastidious for the acid group.
Yeah.
So, ma'am, many students feel difficulty in understanding the fastidious rubric. So, can you please explain how can we identify fastidiousness in any patient and how can we question about this condition to the patient?
Okay. So in general, when we are talking to the patient, when we take all the history, right? So once we are asking, you should talk in a casual way and ask him about his daily routine.
Hmm.
Fastidiousness is like he does the things very neat and clean, right? So tell me about your routine.
Okay,
So
yes.
that is the way you question him, and then he starts answering whatever he does and how he's doing. Or certain people, they suddenly remember, I do this particularly like this. It should be like this.
Okay. So basically, we can say that fastidious is like something, someone who is who want to do his thing in order,
Perfect. In
in a
order.
very organized manner.
Yeah, in a very organized manner. And then he'll tell you, I want to go, or I want my dinner at a particular time compulsory. Otherwise,
Yes.
I cannot tolerate. I shout at my wife or something. Any other things like his, if he's an employee, he has to reach his office on time, or if he's a if he's a boss, he wants his officers or
matlab,
and yeah,
okay,
people
they
working in
want their work in a very disciplined manner.
disciplined manner. Yes.
Okay, thank you so much, ma'am.
Yeah.
So this webinar was very interactive, and I would like to say that the pictures you have used in the PPT, those are very helpful for the understanding of acid group. Like
Thank
you
you.
have shared the signature doctrine, yeah, signature of doctrine, and the way you shared the all pictures regarding the symptoms of acid group. Those were very wonderful,
Thank you, Dr.
and I
Man.
hope, thank you, ma'am, and I hope everyone has enjoyed this webinar. Okay, ma'am, let's end up this webinar. Thank you so much.
Thank you, Dr. Mansi.
Okay.